Welcome to the Rehab Links Secrets to Success podcast. I'm Lisa Chase, your host, and today I have joining me Dr. Annita Winkels. Hello, Annita. Welcome.
Hello, Lisa.
I'm
Glad
so
to see you.
This is so great. I've been wanting to have you on the podcast for a while, and I'm so glad that you're joining us. So, a little background on Annita. So, we met back, I think, in a Mark Bookout course. I think that was maybe when you and I first connected, when we started taking the manual therapy courses. And I know over time, you also then started taking the Michigan State, and we kind of have collaborated over the years. You're an entrepreneur, I'm an entrepreneur, and we just connected in many different ways, both clinically and in business. You are in Duluth, Minnesota, and you've got two practices called In Motion Physical Therapy. And I know that you just, passed a very big certification exam at Michigan State. So congratulations. That is a definite big, achievement. So I commend you for going through that and upping your manual therapy skills, which I already know were exceptional. And you specialize in orthopedics and sports medicine and pelvic floor. So I'm really going to be interested to hear, how you're tying that into your practice and obviously into clinical outcomes. So why don't you kind of just start by giving us, a little background on you and about your practices and how you kind of, got into physical therapy and having your own practice.
Well, thank you for asking, Lisa. And again, thank you for having me on. This is so fun to see you. It was great being at Michigan State with you and just really connecting with the roots of the value of osteopathic manual medicine. And I've learned so much through you, through Mark Bookout. Was really, I joke that I've always wanted to be the Mark of the North. And so taking that certification was really this great gift to Mark's legacy. For me, it felt like the best gift that I could give, recognizing his value. And, Mark created the exercise class for Bookout with Rehab Links and at Michigan State. And that's just a great asset to our program and what we do here at the clinic. The little bit about my background. So it's actually in motion therapy, not in motion physical therapy. And I only say that because there's a couple of other in motion physical therapies across the country. And so I just don't want that confused. Just going back to my core roots of who I am as a person, I grew up in my rural farming town. I used to nurture animals that were injured and take care of them. So it just goes back to the core of who I've always been, is just having a soft spot for beings that don't move well. My stepfather was a laborer. He always had back pain, standing on concrete floors. I used to massage him and watch the Twins game and rub his back and make him feel better. And I was also an athlete, 3-sport athlete. And so when you saw that person have an ACL injury or people having, shoulder pain or things like that, and they couldn't play their sport, that just always was a tender spot for me. So it all just kind of grew into who I am. And I then in high school, at the end of my high school years, I was like, I want to be a physical therapist. And so I did that. I went to graduate school at St. Scholastica and I got my master's degree, went back for my doctorate. And then once I found out about Michigan State and osteopathic manipulative therapy, I was like, I want to keep learning and grow more. So that's how I got into physical therapy. A little bit about my background in starting in motion therapy. After I had worked in other facilities, more corporate health systems, such as Mayo Clinic, which is world renowned, the Fairview Health System, and I had also had some experience in transitional care. I really landed in orthopedic therapy. I found that was my jam. And I was practicing at the Institute for Athletic Medicine and enjoyed that, but I always felt like I wanted more, or is this all that physical therapy is? And So I took a break from PT actually, because I just felt like it wasn't quite as satisfying as I had hoped.
Mm.
Went into pharmaceutical sales for 1 year.
Oh, wow.
Just 1 year. And that moved me to Duluth. And it was a good experience. Sometimes you don't know, you just have to explore that. And I did that for a year, and I realized I'm a clinician. I need to go back to my roots again of being a nurturer and that type of person, and use my gifts that I had. And so I took a position with a company called Orthopedic and Spine Physical Therapy in this small town that I commuted a half hour to. I could have worked locally, but again, I didn't want to be part of a big health system again, because I'd already been there and done that.
Yep.
So I went to Orthopedic and Spine Therapy, and that's where I met Mark Bookout.
Okay.
And it was that's when I just started learning and growing as a clinician. And I just knew it was much more than stretching and strengthening. It really gave me the understanding of the why we do what we do,
Yeah.
and you go through PT school, you learn about diagnosing back pain, hip pain, shoulder pain, but you don't always know where the source is coming from.
Right.
And so that was 18 years ago, that really became my quest to grow professionally. And since then, I had taken, 8 courses through Michigan State, 16 courses through Bookout seminars,
Wow.
11 pelvic floor courses, and just 12 other orthopedic courses. So
Wow.
lifelong learning
Yeah.
has always been a part of this. And so when I knew that I didn't want to continue to work for someone else, I wanted my own practice. And so when I was engaged, I talked to my husband about, do you think I could do this? And he's like, very supportive. So I opened up in motion therapy in 2007 in Duluth. And we just started growing. We just grew and grew into 2 locations. I've just hired my 10th clinician.
Wow.
She's just being trained in today on our EMR. And so it's been such an incredible journey. And I'm so blessed and so fortunate to create the space for the team to elevate the profession. We grow and we mentor, and we just do interact so well together. So it's kind of creating that A team of clinicians that I get to be around every day, which I love.
Yes. And that's one of the things I love about when you and I get together, is that we both have that thirst for knowledge, not just in being great clinicians, but also in becoming great leaders, right?
Yes.
And we've talked a lot about that. And, I think when we're younger, we're constantly seeking and learning to be better clinicians. But the real gift, I think, is in becoming a leader and helping to lead others and helping to teach and mentor them. And I know from our conversations, you've certainly done a lot of that with your team. So I think that's something that we have in common. And I love sharing the different ideas and things that you're doing with your team and your clinicians, and how you're elevating the experience. Because, I think creating a great environment for our therapists, for our team, is what helps us also get great outcomes, right? And just for the
Absolutely.
patients to just feel really well cared for.
Yes,
So
absolutely.
I love that. Yeah. Well,
Well,
it
thank you.
has been quite the journey. So I know that you do a lot with pelvic floor. And so I'd like for our listeners just to have a little bit, I know that pelvic floor has kind of become a little bit more of the buzzwords, right, over the last couple of years, but I know you've been doing it for quite a long time. And so, speak to, pelvic floor and how that really, kind of goes within your differential diagnosis when you're working with clients, particularly orthopedic clients, right? A lot of people think of pelvic floor as, urinary incontinence, but it really could be back pain, hip pain, right? Other orthopedic situations that come in, and a driver is the pelvic floor. So I'd love for you just to touch on that, because I know that's one of your passions and expertise.
It is. Thank you for asking that question, Lisa. It is one of my passions. I think I started my training in pelvic floor in about 2000, and it was kind of, I didn't realize this at the time, but I was an early adopter to pelvic floor health. And so I really appreciate that experience. In PT school, pelvic floor wasn't even brought up and that type of stuff. And so now it's great that it is being brought up clinically and in the PT programs in the profession. But what I love most about pelvic floor is not just how working with pooping, peeing, and sex and issues related to that, but how the pelvic floor influences so much musculoskeletal function. Because
Yeah.
if that pelvic floor is on state or is hypertonic and really tight, it's going to affect your hips. It's going to affect your back. And there's research to prove that pelvic floor dysfunction to low back pain is more prevalent than obesity is to back pain.
Wow.
And so it's really important to every patient that comes into my practice that has some type of back pain or hip pain. I will often ask questions on if they have any conditions related to the urinary system or any incontinence, if they have, pain with, issues with bowel function. And then, and I'll say, I know this is a bit personal, but because I'm a pelvic floor therapist, are you having trouble with intimacy and or intercourse?
Yeah.
Because it all interconnects with each other. And when you move an arm or a leg, it all crosses through the pelvic floor. And
Yeah.
so understanding its role in what we do is vital to effective diagnosis and treatment of patients with musculoskeletal pain in, the lumbopelvic hip complex for sure.
Yeah, I think, and I just, yeah, I agree. And I ask those questions, and we have a therapist here that does, pelvic floor. I've done training in it. I don't do it as much per se like you do now, but definitely understanding, the importance of it. And if I always say, even like when I'm teaching at Michigan State, if you don't know how to assess the pelvic floor, then get with somebody in your community who
Yes.
does and collaborate with them, because that could be a great partnership and a great benefit to patients that maybe, it's the missing link that they're not getting better. And that's the missing part, that if you just address that, they could really get better.
Yes, you said that clearly. It is the missing link, and it's the misunderstood part because of its role in intimacy and being a private area. And yet at the same time, it's so vital to movement and function. And I think, we've got 4 pelvic floor providers in my practice, and so my other providers lean into us when there's something not happening and their outcomes are not getting better.
Yeah.
I had so much fun at Michigan State before the certification exam. I actually got to present to the residents on, how they can screen for pelvic floor dysfunctions, and it really starts with breathing. It starts with really understanding like the obturator internus and how to palpate that, the pelvic diaphragm. And it was just such a great time to help them make that connection, because I think a lot of people, they're not as comfortable doing that, but it's
Yeah.
very relevant. So,
Yeah, and how
yeah.
great that you can, speak to the residents, coming, getting ready, to really go out in the world and make a difference, and to be getting that, that information early on is really great. So that leads us into the next question, which is
All right.
your top 3 valuable tips in getting great outcomes.
Well, it's so fun just recently. So we do keep track of outcomes, and we use them. We've used Photo in the past. We actually are using Keat at my practice, and they have the minimal detectable change. And as a group, we are all exceeding our outcomes, and so it's really fun to see the fruit of our professional development here at InMotion and how well our team does together. In terms of, my 3 best important things for outcomes is 1, lifelong learning. You heard me speak earlier about the amount of courses that I take. I've been practicing clinician for 24 years, and it's still like, what's next? What else do I want to do? And I recently listened to one of Mark Bookout's podcasts, and I heard them talking about how he often would be at the dinner table saying, well, look what I learned today. This is what I learned today. The body is such a complex organism, and we are so privileged as clinicians to be able to interact with this moving, living, complex being, both from a social emotional perspective and a biomechanical perspective. And to have mastery is not an end point, but it's an ongoing process. And so again, I think that's why you and I get along so well, Lisa, is just we realize that there's continuous more to learn and to grow from each other and that type of stuff. So that'd be my number one, would be continued lifelong learning.
Yes.
I have to get a pen.
Absolutely.
So number two is, just really not just looking at where the pain is coming from. Someone comes in with knee pain, really looking at what's happening at the biomechanical complex in the lumbopelvic region, what's happening at the ankle, how are they moving through their body. We can't just assume the knee is a knee problem, though that's where the symptoms are, that's where the tenderness may be, but we have to understand the entire kinetic chain and not just isolate the treatment to that physician referral or what that ICD-10 code is. But I can't look at a knee without evaluating the hip, without evaluating the pelvis, without evaluating the ankle. And so I think the specificity of the global approach is much more valuable than a siloed approach to what the patient came in for.
Absolutely.
And go ahead.
No, I'm saying absolutely. I think a whole body approach is just so critical. And I think now more than ever, I have patients all the time that are coming in. They're so frustrated because they have a shoulder problem, a hip problem, an ankle problem, and they have to go to 3 different practitioners who will only look at that one joint. They will not look at anything else. They won't discuss anything else. They're like, nope, you'll have to make another appointment with the spine doctor or with the hip doctor. Like, I can't look at that. And it's just doing patients such a disservice, and you're not going to get the outcomes that we know that we can get when you're just looking at something in isolation like that. So yeah, I'm a big proponent of looking at the whole system for sure.
Yes, absolutely. And, well trained with Mark Bookout and Bookout seminars in Michigan State. That was really helpful. And that's where I started growing as a clinician. Whereas, like I said earlier, when it was like, oh, let's just stretch this muscle, let's just give this strengthening exercise to the shoulder. But why is it there in the first place? And that always baffled me. And so, yes, look at the organism as a whole is critical. So. And lastly, I think is just that empowerment piece, empowering the patient, and empowering comes through the education that you give to them about the why, because then they get the buy-in. I'm just not throwing dumb exercises at them, but they understand, that I really care. Yeah. Because I've dug deeper to figure out where their source of symptoms are coming from. Second, so that's given the buy-in. Then when I'm doing the manual therapy, I'm following it up with the specific treatment that they can then self-care, because my goal is not to keep doing manual therapy. My goal is to empower them to be self-aware of what their condition is, and that starts with understanding asymmetry within their system. Like, can you feel the quality of how this arm moves versus that arm? Can you feel the limitation, range of motion, or strength? Can you feel that restriction in mobility? And so them understanding, empowering them with the why, providing them the tools that complement the manual medicine that we do, and then to keep building on their growth so that they can be independent on their own and aware of how to self-manage their symptoms. So I think that leads to good outcomes.
Yeah, absolutely. And I think, it's interesting because, again, over the last couple of years, what I've seen is patients come in and they're like, years ago, it used to be they would come in and they bring this stack of exercises, right? They'd be like,
Yeah.
I have like, a whole booklet of exercises and I'm overwhelmed and I don't know what to do. Then the pendulum swung the other way, where now therapists aren't giving any exercises out, and patients come in and they're like, like, what can I do at home? So
Right.
it's that balance, just like you said, it's great to do manual therapy and to make corrections in people's bodies, but giving awareness, and then being able to give an exercise that's going to complement what you just did, so they can continue that at home, and then they're going to continue to get better. And that's what I loved when I took the exercise course, because it really laid down those foundational things that you can do to understand, well, what's going to be the most effective exercise, once I mobilize, the hip. Okay, here's what I can give at home to not only mobilize the hip, but to activate, the glute, things like that. So I do think that is definitely helps with getting good, outcomes for sure.
Absolutely. That was my first class. I was so blown away with Mark Bucco, was the exercise course.
Yeah.
And I was like, oh, this makes sense.
Yeah.
Because I never understood why you're strengthening, why the right glute isn't strong versus the left glute, but they just ran a marathon, and that understanding of inhibition and that type of stuff, and how that effective awareness. So then when they are actually exercising, which patients are wanting more, but they want the right one, because they can pull any exercise off the internet. They can look up hip bursitis and say, oh, these are the 10 things to do. But why do they have hip bursitis? Is it a pelvic floor problem?
Right.
Or is it because of an ankle problem that's inhibiting their glute and their dorsiflexion? And so, empowerment is about that connection with that patient at that time for their specific condition, not a link to a website and here's your 10 exercises, right? Like,
absolutely.
it's the specificity, and that I really appreciated from
Me
Mark
too.
Bucco.
There were lots of wow moments, right? And moments with Mark in general, whether it be muscle energy and exercise. But I'm with you. The exercise course, definitely, between the muscle energy and the exercise course, it just kind of was like a complete game changer, in my thinking and in my practice. So absolutely. Well, I know you teach, I know for several, but whether it be at university level or at the Pelvic, I think it was Pelvic Institute for
The Pelvic Rehab Institute. I've done some guests, or I've been a teacher's assistant, so I've helped with the lab work for the Pelvic Rehab Institute. I've been invited to the University of Minnesota Duluth, to the med school, to present on pelvic floor. I've, again, recently was at Michigan State. I've also have been adjunct faculty at the College of St. Scholastica and like Superior College, but I just really love the clinical work and that type of stuff. So I've stayed with more of a clinical focus and empowering my team through a mentorship program that we have here.
So with, I guess, your mentorship and with the different teachings that you have done, what has either your therapist or your audience, whether it be through students, that you're teaching, what are like one or two things that they like really appreciate about you and what you've been able to bring and to share? Like, what do you hear over and over again?
I think it just goes back to specificity, and how to look at the body system as a whole. I think the appreciation of that, of how to effectively scan the body to find out exactly where that driver of symptoms are. And that can feel a little overwhelming, but I think how to break it down into a biomechanic. This is the biomechanical problem. This is a neurodynamic problem. This is a fascial restriction, or this is a motor control problem. And so I try to break it down into those 4 categories so that they can see and be aware of where to start. And so I think they appreciate understanding how to enter into somebody's system and where to go from there. So I hope that helps or answers your question.
Yeah. Okay. So, so one other question that I just thought of that I, was just kind of came to my mind, but I'm curious. So as a leader in your organization, how do you empower your therapist to kind of rise above, right? To have that growth mindset, to be a constant life learner, right? How do you embody that and nurture that and empower your team?
Well, that was my number 2 response was empowerment. But I think part of empowerment is showing clinical excellence yourself. So being a model in that I'm a continued lifelong learner and not complacent, and I just don't stop and expect everybody else to do the work. So continuing to grow myself professionally. We also have a mentor program at my clinic, and we set aside time twice a month where we connect and grow with our clinicians. We have quarterly skills that we go over with each other as a whole team. And then we also bring in a CME course that we all collectively take together. And so I'm really grateful for all those things, because it's not about what I do, but it's about what we do and our connection so that we can better serve our patients. And it's great. It's wonderful. So
yeah, well, that's great. Well, and I've met several of your therapists, and you and I have talked about, all that you have implemented. And I just think it's just great, to be able to, I think, have that kind of environment. And, I think therapists deserve, to have a great working environment where they have a leader who is setting the example of, being a constant learner and wanting to mentor and setting up those systems to help, each one grow. And I know you partner your therapist, right, with a senior therapist when they come on. And yeah, I just think that that's really important to nurture, therapists and help them, continue to grow. So I think it's great. Yeah.
Thank you. I think it goes down to having a solid collective. The other insight is a collective foundation that we all speak the same language. So we're not just a clinical practice that, and I know this happens in other larger systems, this person's the shoulder person, the shoulder expert. This person is the knee expert, and this person is the ankle specialist. And the last I knew, it was all connected, and we can never move. We can't walk without all of our lower extremities in synchrony together. And so that's always really bugged me. And so having that connection, that we're learning and taking classes consistently together so that we have the same language and we can share. And I still have some clinicians do dry needling, and I think that's great and has a lot of value. I don't do that. And so if I reach a standstill with a patient, I'm like, that's a great option. I can lean into my clinicians that do dry needling, or my clinicians that don't do pelvic floor. They can lean into us. And so not that we all have to be copycats of each other, because in fact, we're better having an eclectic mix, but having this solid foundation together is necessary. I think it's an absolute. And that's where I joked that I wanted to be the Mark of the North, because I saw through when PTOSI was independent, that's what I saw through that group. And that's what I'm like, I want to model that, because it's not about just Annita Winkels skills. This is about us collective as a whole, because musculoskeletal has not been greatly addressed. The healthcare costs of musculoskeletal continue to rise. And we as clinicians need to do a better job of serving these patients so they don't go in a downward spiral. So.
Yeah, no, I think Yeah, it's absolutely, it's just, yeah, it's critical. So it's great.
Yeah.
Awesome. Well, this has been so much fun to sit and hear your insights on things. So, tell our audience how they can find you in case anybody is, in or near Duluth. I know you guys do a 20-minute, free consultation. So, we will put your information in the show notes, but let people know how they can find you.
Well, thank you. So our website is www.inmotiontherapy.com. Pretty basic. And our telephone number in Duluth, Minnesota is 218-727-1180. 218-727-1180. And we have our two locations, one in Duluth Heights, and the other location is in Lincoln Park on 27th Avenue West. So we're cover both sides of the Duluth community. So we're ready to serve you and serve our community.
Awesome. Well, thanks for taking the time to chat with us and share with our listeners. We appreciate it. And so until next time, keep getting great outcomes.
All right. Thank you so much, Lisa. Have a blessed day.
Thank you. You too.